Ever feel like health insurance makes zero sense? Are you sick of getting burned by confusing deductibles and coinsurance? And be honest, do you believe that just because you have insurance, it should cover everything? Now, let's break this down in plain English. And at the end, I'm going to share the option that actually works for people who want real care, not a maze, including what my family actually uses. So, a lot of people ask me, what's the best insurance company to get? Blue Cross, Blue Shield. Here's a simple breakdown. There's going to be two main categories. You got HMO and PPO. HMO means you have to see providers inside their network. It's extremely restrictive. Now, if you go outside their network, you're not covered. The provider's only going to get paid if the insurance company approves it. Sometimes even before you get care, sometimes after. If they decide not to approve it, you pay the entire bill yourself. The upside, HMOs usually have lower monthly premiums and predictable costs, but you sacrifice freedom of choice and flexibility. Now, the PPO is going to give you more flexibility. There are two options within the PPO, in-network and out-of-network. Out-of-network is like being a free agent. The provider accepts your insurance but isn't contracted with your plan. At our center, a Light and Bone, we're fully cash-based, no networks, no contracts, no insurance company sitting between me and you and your needs. And here's why that matters. Let's talk about deductibles. Your deductible is what you pay before your insurance benefits actually kick in. For example, if you have a $500 deductible, you'll pay the first $500 before insurance covers anything. Sometimes things like exams or x-rays might bypass the deductible, but often they still count toward it. Bottom line, no coverage until you meet that deductible. Then there's the percent coverage. Say your visit is $100. Insurance says they're going to cover 50%. That's $50. But co-insurance is different from a copay. If your co-insurance is $50, you basically help the insurance company pay their portion. So they pay $50, you help with half of that, which is $25. That means insurance pays $25 and you pay $75. Then comes the allowable charge, the maximum your insurance company agrees to pay for a service. If your provider charges $100, but the allowable is $80, they apply coverage to $80, not $100. So if they cover 50%, that's $40. Then coinsurance might apply again, and you end up with a bigger out-of-pocket share. And one more twist, with many Blue Cross, Blue Shield, or Cigna plans, there's a third party called American Specialty Health Network. After about 5 visits, they step in to decide if your care is medically necessary. If they say no, you pay out of pocket, even if your plan says you have more visits available. So here's the bottom line at our practice. We are fully cash-based, no networks, no waiting on approvals. Every dollar you pay goes towards your care, not paperwork. You always know exactly what you're paying and why. All right, let's shift gears. The best option I found to pair with our model of care isn't traditional insurance at all. It's called a health share. What's a health share? It's not health insurance. It's a community of people who share each other's medical costs. There are no networks, no pre-approvals, no authorizations. You pay your provider directly, submit the super bill, and get reimbursed, usually in full. My family personally uses Crowd Health, and I recommend it to all my patients. They cover things traditional insurance barely touches, such as like home births, midwives, doulas, chiropractic care, alternative care. Plus, they cover the basics of regular medical care, too. There's no insurance runaround, no third-party approvals to slow things down. You work directly with your provider, submit the bill, and the community organizes the payment. It's simple, community-driven, and works beautifully for people living in a holistic, vitalistic lifestyle, especially here in Encinitas or North County, San Diego. So if you're ready to break free from the insurance maze, I got a link below to check out Crowd Health. It might be exactly what you've been searching for. And when you sign up, tell them that we sent you. Stay aligned, stay connected, and stay powerful.